Hi, so I'm going to talk about OCD and intrusive thoughts, and the reason I'm making this video is because recently I have been working with a lot of clients who are experiencing intrusive thoughts that feel very real to them, and they really worry that these thoughts have some sort of meaning or some sort of power. And the nature of these thoughts are often about causing harm to themselves or losing control in some way. And these thoughts can also be about causing harm to another person as well. So I've worked with a range of clients recently, and that inspired me to talk about this topic, to educate people and to help them know what to do if they've been having some intrusive OCD style thoughts. Often people don't know that this is an OCD thought. They just know that they feel very anxious, and they're often very worried that they may take an action. They're often not wanting to say these words out loud in case that it has some meaning or has some power over the situation. So I had a person recently that I was helping who was pretty much on the verge of panic attack, and he gave me a call and he said, I just feel awful. I feel something terrible is going to happen. I've been having all these thoughts. I don't want to say them. I'd hate to say what it is, but I'm just very anxious. So I probed a little bit, and I realized that the thought that he was having was that he was going to lose control and commit suicide. Now for me, this was very different to a client who has intent that they would commit suicide. It sounds completely different. And to me, it's very easy to distinguish one from the other. When I speak to suicidal clients, they're incredibly hopeless, and they believe that their life would be better if they were not around. And sometimes they're so hopeless that they may even be making a plan to end their life. It's something they want to do. Essentially, they might be very scared of it, but there's actually some sort of ideation or intent there. And then what's completely different is the person who's got OCD, who's terrified that they might lose control and harm themselves in some way, or commit suicide, or harm another person, or whatever the intrusive thought might be, which can be lots of different types of thought, but often they are centered around the same kind of themes. People have very similar types of thoughts when it comes to this kind of thing, which tends to be the worst possible thought for that person is what the intrusion is about. So, for example, someone who's very religious can have very blasphemous thoughts. Someone who would never want to harm themselves or harm another person, their thoughts might be of that nature. Someone who cares very much about children may worry that they could cause harm to a child. Again, very different from having the intent or wanting to do whatever action. So when this person called me and they said that they were very worried they might commit suicide, I said, well, I'd love to do some exposure work with you. I know you're really anxious right now and you're on the verge of having a panic attack, but let's do something really unusual. Let's try and make these symptoms worse. Let's try and make the situation worse to prove to you that you're perfectly safe and nothing bad is going to happen. So I said to this person, is there a window near you? I'd like you to go to the window, open it up, and have the thought, I'm going to commit suicide. And he was absolutely terrified. His anxiety, I got him to rate it. It was 10 out of 10. He even rated it much higher than that. He was absolutely terrified, but he had a lot of trust in me, and he really trusted that I knew what I was doing and that I would guide him in the right way. And he stood by the open window for some time having this thought, I'm going to commit suicide. He was terrified that he would somehow lose control and that would happen because of his OCD. But of course his body did not move. He had no intention whatsoever of doing this. He didn't want to do this. He was just scared that he might. And with time, as he stayed there over a couple of minutes, he realized that actually there was no power to this thought whatsoever. His anxiety levels shot right down, and he felt much better. Another example is a very similar person I was helping who was having the same thought, I might harm myself, I might lose control, I might commit suicide, and was incredibly anxious. I said, well, what would make that thought worse? What would be your worst case scenario situation? Could you hold a knife? And he said, well, yeah, that would be terrifying. That would really make the anxiety worse. And he was feeling very bad when he was speaking to me, which is very hard to convince people to do exposure work when they're feeling that anxious. So really, the person has to have a lot of trust when I'm working with them to even do it, because a lot of people just point blank refuse. But when people do have that trust and they are brave enough to do this exposure work, I tend to get great results with people. So for this particular client, he held the knife and he was holding it, and his anxiety levels were very high, and he was repeating the words, "I'm going to commit suicide." And he was focusing on what that meant, and really doing some really great, what I would consider great exposure work. And quite quickly, his anxiety was shooting right down. It was 10 out of 10 when we started. Within just a matter of minutes, it was feeling very neutral. The thought had lost the meaning, and he realized he was perfectly in control. So he was really challenging the OCD thought. And then I said, well, it looks like you're feeling more calm now. Can we up the ante a bit? Can we do something a little bit worse? And he said, well, it's working so far, why not? And I got him to hold the knife to his wrist, and he then repeated the process. So it's good to really reinforce the new belief for someone, because essentially what we're doing is proving that they're not going to lose control, and that there's no power to this OCD type of thought. Then you want to make up the ante a little bit, make them even more anxious again, and get them to do some more exposure work. And I try to, when I work with clients, I try to go for the worst possible case scenario first. I think it saves a lot of time. You do need to have a lot of really good rapport and really good trust with people for them to agree to actually do that, because this is terrifying for people. And usually before I do this work, I will give them anxiety management strategies, so I'm able to help them remain calm and cope with these high levels of anxiety in this situation. So this was just a short video on how to tell the difference between an OCD thought and actually something that's more serious and more concerning. So hopefully this has helped you realize when you might be experiencing some sort of OCD type of thoughts, and I welcome any questions about this topic.